Abigail Roose, summer 2020, BSN1 nursing program. There's my ID. Let me check. Okay, cool. And before starting this procedure, I washed my hands, and so with that, hi, my name is Abigail, and I'll be your nurse for today. Can I have your name and your birthday, please?
Brian Connor, and then 9/20/2000.
All right, Brian, so today we're going to do your heart and your peripheral vascular exam. Do you have any past or current medical issues in those areas?
I have a heart murmur, and then I had edema.
All right, heart murmur and edema. So first on Brian, we're going to inspect her neck and her jugular, and we're going to check for any distension. And so if you turn your head to a 45-degree angle to the right, and we're going to check for any distension, specifically on the right side. And so if she had, there's no distension present, but if she had jugular distension, it would be due to a right atrial valve issue, which could possibly be due to CHF. And so next, we're going to check for her carotid artery, and we're going to check for any bruits. And so we're going to palpate between the trachea and the sternocleidomastoid for that. We're going to do one at a time. And so when I auscultate, I'm going to use the bell of my stethoscope, and then Bree, when I ask you to hold your breath, can you please do so? Bree, hold your breath. All right, you can breathe. Okay, and then hold your breath again. All right, and no breeze are present, you can breathe again. No breeze present. So next we're going to check for any lifts, heaves, or pulsations. So Bree, if you could lay on your back. And we're going to look at eye level across your chest from the right side. And so for lifts, we're going to check for any anterior movements in the sternum, which I don't see. And then for heaves, we're going to check for any forceful movements in her PMI area, which I don't see. And then for pulsations, we're going to check for any pulsations in her intercostal areas, which I also don't see. All right, you can sit up. And so next we're going to look at the 5 locations of the heart. And so the first one is going to be the aortic location. That is located at the second intercostal space, and you can hear S2 from there. And so we're going to look at the second intercostal space. All right, and sounds there are clear and strong. Next we're going to go to the left side, and we're going to look at the pulmonic space, and that's also going to be at the second intercostal space, and you can hear S2 there as well. Alright, and sounds there, also loud and clear. Next we're going to look at Erb's point, and that's where you can hear heart murmurs, and that's going to be at the third intercostal space on the left side of the sternum. Alright, and there we can hear Bree's heart murmur that she mentioned. And then after that, it's going to be tricuspid, and you can hear S1 there, and that's going to be in the fourth intercostal space on the left side. Alrighty, and then finally we have the mitral location, and that's going to be at the fifth intercostal space, and it's at the apex of the heart. I also didn't mention the aortic and pulmonic space locations were at the base of the heart, and so the mitral is at the apex of the heart, and that's where you can hear S1 the loudest, and that's at the fifth intercostal space. Breathe, if I may. Yep. Alrighty, and sounds there were loud and clear as well. And so next I'm going to auscultate for Bree's heart rate and rhythm. So I'm going to do that at the aortic location. So I'm going to count for 30 seconds and then multiply by 2. Okay, so Bree's heart rate was about 71, and so her heart rate was regular and clear there as well. And so that's it for the heart exam. And so next we go into the peripheral vascular exam. And so that's going to be on her leg. And normally we do that bilaterally, but for this assessment we're going to do it unilaterally. So breathe if I may.
Yep.
Alright, so first we're going to inspect her leg. Can I lift your leg? For any like color and condition. So her leg appears to be pale with red undertones. And there's some venous patterning on this side of her leg. I don't see anything on the posterior side of her leg though, just on the anterior side. And there's her legs, or her skin is intact, and I don't see any open lesions. And so next we're going to assess for lesions, and it's primary, secondary, and vascular. And so looking for primary lesions, which would be freckles and things like that. And so I see one primary lesion right there up by her knee, but I don't see any others. And then we're going to look for secondary lesions, which would be tattoos, piercings, or scars. I don't see any on any side of Bree's leg. And then next we're going to look for any vascular lesions, which would be any kind of like bleeding or bruising. And I don't see, or petechiae, and I don't see any of that on Bree's leg as well. And so next we're going to assess for temperature and moisture of her leg. And so I'm going to use the dorsal part of my hand. I'm going to feel for temperature and moisture going proximally to distally. Okay, and so Bree's leg appears to be dry, and it gets cooler as you go down towards her toes. And so next I'm going to feel for any edema, because she mentioned she had edema, or previously had edema, so I'm going to use my thumbs and go down the tibia. Alright, and I don't feel any edema present. And so next we're going to assess for pulses. The first pulse is the femoral pulse in the groin, but we're going to assess the popliteal pulse that is on lateral to, or on the back of her knee. I'm going to feel for that. So I can feel it, but it's really faint. So next we're going to go to her popliteal pulse. Not popliteal, I'm sorry. Her dorsalis pedis pulse, which is on the back of the heel. Alright, and then next we're going to go to, there's a pulse here. Okay, and so her pulses were consistent and strong, except I couldn't feel the popliteal one very well. And so next we're going to assess Bree's toes, and so Bree's toenails are painted, so we can't look at the nails themselves, but the skin around it appears to be, no, there's no lesions anywhere, and all the skin is intact, and her toenails are also intact. So next we're going to check for any color return, so I'm going to pinch her toes, and then I need the color to return after 2 seconds. Alrighty, and her toes had good color return, so next I'm going to look between the toes and on the heel for any ulcers. Alrighty, and I don't see any ulcers present. And then going back to her leg, we're going to assess for any abnormal lesions, and so we're going to use the A, B, C, D, E of abnormal lesions. A is asymmetry, B is irregular border, C is color variation, D is diameter, E is elevation, enlargement, and evolution. So I look for any kind of lesions that have that. But I don't see any lesions on Bree's legs. That's all good. So Bree, that completes your assessment. And so at the end of this assessment, we're going to go over any patient safety pics. Make sure Bree is comfortable and back in a comfortable position. And as for the assessment, we didn't find anything super abnormal with Bree. There were no bruises. All of her heart and pulse sounds were strong and regular, and she had a regular heartbeat that fell within normal limits. So that completes the assessment.